and welcome to Neo Psychology of me, your teacher, Mr. Neo, the channel where I teach online psychology lessons for my wonderful students. Today we're doing the last lesson on the psychopathology unit, lesson 11, the biological approach to treating OCD. Let's rock and roll. According to the biological approach, what would be the best way to treat OCD? What therapy would a biopsychologist promote? What do you think a biopsychologist, what treatment do you reckon they'll promote the most? Drug treatment, drug therapy, medication, exactly, okay? So here we are, we're at the end of the unit. We've had a look at 4 definitions of abnormality. We had a look at phobias, depression and OCD. We had a look at the behavioural approach to explaining and treating phobias, the cognitive approach to explaining and treating depression. We had a look at the biological approach to explaining OCD, and now we're looking at the biological approach for treating OCD. So here we go. Learning objective 1, show comprehension and apply knowledge of drug therapy for OCD. And then learning objective 2 is to be able to discuss and evaluate drug therapy for OCD. Let's get started with drug therapy. The biological explanations of OCD imply that biological treatments may be successful, most obviously through the use of drug treatments that target abnormal neurotransmitter levels. Drug therapy for mental disorders aims to increase or decrease levels of neurotransmitters in the brain or to increase or decrease their activity. Now, last lesson we saw that low levels of serotonin are associated with OCD. So, what do we know? They did some tests. They found people with OCD, they got low levels of serotonin. What is the drug that we need to create need to do? What do you reckon? It needs to increase the levels of serotonin, right? Therefore, drugs work in various ways to increase the level of serotonin in the brain. These are called SSRIs. The standard medical treatment used to tackle the symptoms of OCD involves a particular type of antidepressant called a selective serotonin reuptake inhibitor, or SSRI for short. SSRIs work on the serotonin system in the brain. Now, don't worry, I'm going to explain what that means and what all of that means in a second, okay? Now, serotonin is released by certain neurons in the brain. Your brain has got millions of neurons all connected together, making all your neural pathways, okay? And serotonin is released by certain neurons in the brain. It is released by the presynaptic neuron and travels across the synapse, okay? The neurotransmitter chemically conveys the signal from the presynaptic neuron to the postsynaptic neuron, and then it is reabsorbed by the presynaptic neuron where it is broken down and reused. Okay? So, let me explain it using this diagram here, okay? Here is the synapse, okay? So, this is the end or the axon terminal of one neuron, and this part here is the beginning or the dendrite of another neuron, okay? And where they connect is this here, and this is called the synapse. Now, you can see they're not actually touching, there's a gap. This is the synapse where the message gets sent across. Now, the message that gets sent down a neuron is actually an electrical message, okay? But you can't send an electrical message across the synapse because it's not connected. So what happens is the message gets turned into a chemical message, okay? And it's sent across via neurotransmitters, chemical messengers. Now, when the chemical message goes across the synapse and goes to the other neuron, it gets picked up by them, and then it continues the message. It turns back to electrical again, okay? So the neuron before the synapse is called the presynaptic neuron, and the neuron after the synapse is called the postsynaptic neuron. So this is what happens. People with OCD, they have low levels of serotonin. Now, the electrical message comes down the synapse, and it goes, produce serotonin, right? Now, these neurotransmitters, these serotonin neurotransmitters get sent across the synapse. And in a normal person, it gets collected by the postsynaptic neuron. They get enough of the serotonin message, and then it goes, okay, we've got the message, keep producing serotonin, and it sends the message along, and it keeps going, and it does this millions of times across all your neural pathways, okay? But what happens is, when there's leftover serotonin in the synapse, it gets reabsorbed by the presynaptic neuron. That's what happens, okay, in everyone. Now, people with OCD, what they find is, either they're not producing enough serotonin for the message to go across, or the presynaptic neuron is reabsorbing too much of the serotonin before the message has gone across the synapse. And what happens is, the message comes here, it gets into the synapse, or it might not even get that far, and then it can't carry on. And what happens is the message stops, and therefore the body stops producing serotonin. So this biological approach is explaining OCD through low levels of serotonin. Now, what do SSRIs do? Now, SSRIs, selective serotonin reuptake inhibitors, by preventing the reabsorption and breakdown of serotonin, SSRIs effectively increase its level in the synapse, so increase the serotonin levels in the synapse, and thus continue to stimulate the postsynaptic neuron. This compensates for whatever is wrong with the serotonin system in OCD. Okay? So what does SSRIs do? If you think about it, you say what it says, say it backwards, okay? Selective serotonin reuptake inhibitors. It inhibits the reuptake of serotonin, okay? That's what it does. It tells the presynaptic neuron to stop, to inhibit the reuptake of serotonin. Stop reabsorbing the serotonin. So it stops the presynaptic neuron reabsorbing the serotonin, which means it leaves more in the synapse, so therefore there's more that can go across the synapse and be picked up by the postsynaptic neuron, and therefore increase the chance of the serotonin message to be carrying on. Okay? And that's what happens. What do SSRIs do? Well, selective serotonin reuptake inhibitors inhibits the reuptake of serotonin. Okay? Now, dosage. This is a drug. You take it potentially as a pill form. Dosage and other advice vary accordingly to which SSRI is prescribed. A typical daily dose of fluoxetine is 20 milligrams, although this may be increased if it is not benefiting the patient. The drug is available as capsules or liquids as well, and it takes 3 to 4 months of daily use for SSRIs to have much impact on symptoms. So it doesn't work as quickly as there's your pill, you're done. You need to be on a course of it, okay? And it takes time. If it's found that it hasn't made an effect after 3 or 4 months, they may change your medication. But the main SSRI is fluoxetine, and they give you around 20 milligrams usually, okay? Now, combining SSRIs with other treatments. Drugs are often used alongside CBT, cognitive behavioral therapy, to treat OCD. And as we saw in previous lessons, CBT is all about challenging those beliefs, challenging those irrational beliefs. Now, in OCD, you have those obsessive thoughts, and CBT is all about challenging those obsessive thoughts that you have. Those obsessive thoughts, oh, if I don't wash my hands, I've got germs all over them, therefore I'm going to pass it on to my family, and that's going to make them die, okay? That causes you to have anxiety, and that causes you to have your compulsions, your compulsive behaviors, which is washing your hands, okay? CBT is all about challenging those irrational, obsessive thoughts. The drugs reduce the patient's emotional symptoms, such as feeling anxious or depressed, and this means the patient can engage more effectively with CBT. As with most things, they find that a combination of both psychological treatment and biological therapies are most effective. Okay. In practice, some people respond best to CBT alone, whilst others benefit more from drugs like fluoxetine. Occasionally, other drugs are prescribed alongside SSRIs. Now, there are alternatives to SSRIs. As I said, drugs are different for everyone, right? Even paracetamol might not be very effective for some people, and some people may take other drugs that help them more, right? So SSRIs might not be effective for everyone. So there are alternatives. Where an SSRI is not effective after 3 or 4 months, the dose can be increased up to 60 milligrams a day, or It can be combined with other drugs. Sometimes different antidepressants are tried. Patients respond very differently to different drugs, and alternatives work well for some people and not at all for others. Let's have a look. One alternative to SSRIs is tricyclics. It's an older type of antidepressant. Tricyclics are sometimes used, such as clomipramine. These have the same effect on the serotonin system as an SSRI. Clomipramine has more side effects though, than SSRI. So it's generally kept in reserve for patients who do not respond to SSRIs. So SSRIs is the main one, but if they don't work, you can try tricyclics, right? Like clomipramine. Now they do have more severe side effects, so usually you start off with SSRIs. Another alternative is SNRIs, serotonin noradrenaline reuptake inhibitors. In the last 5 years, a different class of antidepressant drugs called SNRIs has also been used to treat OCD. These are, like clomipramine, a second line of defense for patients who don't respond to SSRIs. SNRIs increase levels of serotonin as well as a different neurotransmitter, noradrenaline. Okay, and that is drug therapy. Fill in the gaps, give it a go, 2 minutes. Draw an image to illustrate the key term as well, okay? Drug therapy involves drugs. Drug therapy treatment involves drugs, i.e. chemicals that have a particular effect on the functioning of the body or brain or someone or some other body system. In the case of psychological disorders, such drugs usually affect neurotransmitter levels. And as we know, SSRIs affect the serotonin levels of people with OCD. Okay, we've got an application question, AO2. Let's apply our knowledge, our AO1 knowledge, to an AO2 scenario about Akash. SSRIs are the first line treatment for OCD. They may be taken alone or with a psychological therapy. It may be possible in some cases to just have the psychological therapy. Akash is a busy entrepreneur with a young family. He has a recent diagnosis of OCD and his doctor prescribes drug treatment, fluoxetine. Akash has always been healthy and never thought much about taking drugs before. He inquires about the possibility of having a psychological treatment instead of the biological therapy. Given Akash's lifestyle, can you see any reason why fluoxetine, the SSRIs, might suit him better than psychological treatment? And then number 2, what else might Akash's doctor advise him to do to relieve his symptoms for OCD? Okay, 2 questions, 5 minutes, give it a go. Okay, here we go. Given Akash's lifestyle, can you see any reasons why fluoxetine might suit him better than psychological treatment? Well, Akash has a busy lifestyle, and one reason his doctor has prescribed drug treatment may be that drugs are not usually disruptive to a patient's life. It might be, for example, hard for Akash to fit in regular psychological therapy around his work and family life. And yeah, if you think about it, right, CBT therapy, it requires a lot of commitment, right, a lot of time and effort, and it takes a long period of time. Right, I've got to book time out. I've got to take time out from my family, away from my work as well. And then I've got to go and see a doctor. And over many, many sessions, I may show improvement. Or the alternative, drug therapy. Here's your pills, pop a pill, done. Okay, yeah, I'm feeling better after a few months. Pop, 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 pop my pills, right? You know, whatever the medication says. What else might Akash's doctor advise him to do to relieve his symptoms of OCD? Akash's doctor might advise him that if SSRIs were not effective on their own, that he might consider changing them for a different drug like clomipramine, or alternatively, he might combine drug treatment with a psychological therapy like CBT or a behavioral therapy. And that's drug therapy for OCD. Identify one thing you've learned about drug therapy. Why do you think learning about this is important? How does drug therapy apply in real life? Who is this information useful to? What questions has this raised for you? Give that a go now. And that's learning objective 1 done. Show comprehension and apply knowledge of drug therapy for OCD. Tick. We're moving on to learning objective 2 to be able to discuss and evaluate drug therapy for OCD. Let's have a look. Evaluation AO3. What are some of the strengths and limitations of drug therapy for OCD? Drug therapy is effective at tackling OCD symptoms. There is clear evidence for the effectiveness of SSRIs in reducing the severity of OCD symptoms and so improving quality of life for OCD patients. Sumbro et al. In 2009 reviewed studies comparing SSRIs to placebos in the treatment of OCD and concluded that all 17 studies reviewed showed significantly better results for the SSRIs than for the placebo condition. Effectiveness is greatest when SSRIs are combined with a psychological treatment, usually CBT. So one strength is that drug therapy is an effective way of tackling OCD symptoms, right? Research has shown that it is effective. Furthermore, drugs are cost-effective and non-disruptive. An advantage of drug treatments in general is that they are cheap compared to psychological treatments. Using drugs to treat OCD is therefore good value for a public health system like the NHS system. As compared to psychological therapies, SSRIs are also non-disruptive to a patient's lives. If you wish, you can simply take drugs until your symptoms decline or not engage with the hard work of psychological therapy. Many doctors and patients like drug treatments for these reasons, right? Drugs are cost-effective and non-disruptive in your everyday lives. However, drugs can have side effects. Although drugs like SSRIs are often helpful to sufferers of OCD, a significant minority will get no benefit. Some patients also suffer side effects such as indigestion, blurred vision, and loss of sex drive. These side effects are usually temporary though. For those taking clomipramine, side effects are more common and can be more serious. More than 1 in 10 patients suffer erection problems, tremors, and weight gain. More than 1 in 100 become aggressive and suffer disruption to blood pressure and heart rhythm. Such factors reduce effectiveness because people stop taking the medication. All right? So one massive limitation of drug therapy is that drugs have side effects. Okay. Can you summarize each evaluative point into exactly 10 words? Okay? One strength of drug therapy is research finds it's effective. 10. There you go. Do it yourself. Can you think of any further criticisms of your own using the Grave and Scout technique? Grave, generalizability, reliability, application, validity, ethics. Scout, supporting evidence, conflicting evidence, other theories, usefulness, testability. And that's the evaluation of drug therapy for OCD. Learning objective 2, to be able to discuss and evaluate drug therapy for OCD, done. Plenary now. Multiple choice questions. Drugs are often used to treat OCD for which of the following reasons? A. No side effects of drugs. B. The cost of drugs compared with other treatments. C. The time taken for drugs to affect symptoms. D. The permanent cure offered by a course of drugs. Right. The cost of drugs compared to other treatments. What is the most common biological treatment for OCD? SNRIs, CBT, SSRIs, clomipramine. It is SSRIs. Which of the following is not a side effect of antidepressants? Memory loss, reduced sex drive, weight gain, depression. Depression isn't a side effect, apparently. Which of the following statements is true? A. A standard dose of fluoxetine is 20 milligrams a day. B. SSRI should not be combined with any other treatment. C. Fluoxetine is also known as Valium. D. SSRIs can take up to 4 years to have an effect. Right. A. A standard dose of fluoxetine is 20 milligrams a day. Okay? How many questions did you get out of 4? Are you an absolute legend? That was lesson 11, the biological approach to treating OCD. And that is the end of the psychopathology unit. And there we go. Well done, my neo-psychologists. Great work in this unit. I hope you found it useful. I've been Mr. Neo. If you've got any questions, leave any comments. Otherwise, God bless and peace.
I'm feeling like Will. I feel like a prince, I'm feeling myself. I'm loaded with bills, cause I wasn't blessed with no Uncle Phil. Don't know how it feels. I wanted to flex, they told me to chill. I'm making a flip. My life is a flick, now load up the film.